So my job is fascinating. I'm a hormone specialist. I have 3 male patients, and the rest I have thousands of lovely lady patients. I might have even some of you, I hope so. I don't need any more, but I'm delighted to see you, of course. I have many. Hormone specialists know about hormones. Hormones are chemical messengers. They're made in one part of the body. They move somewhere else. It's fascinating. And they do a particular role. They might travel a very small distance, hypothalamus to the pituitary, or right round the bloodstream and make an action appear somewhere else. We all need hormones to live. We're dead without them. So that makes me sort of important in my own mind. Now, there are 3 female hormones, main sex hormones. I've said that word. We're going to the next slide. How about that? Estrogen acts all throughout the body. Estrogen is responsible for making us a girl. We grow girly bits because of estrogen. But guess what? Men have estrogen as well. Do you believe that or not? Yeah, oh good, that's good, we're in the right room. Progesterone is very necessary for implanting an egg and making a pregnancy happen, and will only, those levels will go up if you've ovulated. Now testosterone, my PhD was based on testosterone. So I studied 1,423 women from around Victoria and looked at what happened with testosterone with age. And I found that testosterone actually dropped with age. We do have testosterone, we need it. I think everyone in this room has got testosterone if they've made it here tonight, and Nellie has a very good dose of it, but which is excellent. We need testosterone to function, and certainly. But that's something that's very important for mood, memory, brain function, and sexual function as well. So some women can come unstuck when their testosterone is very low. And I can talk to anyone about that at any time, but I'm whizzing right along to the next part, which is women are very unique. So the next slide looks at hormonal changes throughout life. So in our sort of infancy and toddler years, there's not much happening hormonally. There's thyroid hormones and growth hormones and all that sort of stuff, but there's not much happening with the estrogen type of hormones. Remember puberty? Do that one all right? Shocking time of really big surges of hormones, terribly big changes. You don't know if you're Arthur or Martha, but you become one or the other mostly. It's a bit fluid these days. And then men stay in the reproductive phase. At 99, if all God willing or God not willing, they can still be a daddy, all right, in this day and age. But women have this very unique physiology or function whereby they have a reproductive phase. They can have pregnancy, childbirth, but after that, there's a change in hormones, typically from the 40s, which is called perimenopause. I'm going to go through that in a minute. And then a third to a half of our lives are in the postmenopausal phase. Very, very important time, very, very destructive time for some women. And if you're in this room in your 40s and you're struggling and nothing else in life is changing, then I think it's going to be about perimenopause. And I find that a very, very difficult time to manage for women. But I'm going to tell you all about it, and there's definitely help out there. So we'll look at the next slide now. Why does menopause occur? Do you know what? Whales and gorillas are the only other species that undergo menopause. Okay, so humans are sort of unique there. I think it's because the other animals don't live long enough, but it's a special thing. And it is programmed. We're meant to go menopause on average between 45 and 55, but there's a very tight range for Australian women. It's usually 51 to 52, unless there's surgery or an induced menopause or a premature menopause. Now, if you are 40 or below and have had menopause, or someone like me should see you, because it's a very, very different scenario. You have sort of been robbed of estrogen far before the time that you're meant to. It's not common, but those women are really at risk of heart disease and bone health problems, and those women really should be seen. So if there's someone in your family like that, get them to medical attention. So there's lots of other causes of menopause. It is natural. So people say, why are you medicalising menopause? You shouldn't, it's natural, etc. It is natural, but we're not meant to be looking after ageing parents, looking after children, doing all the things that, make us a Wonder Woman, and cope with really drastic hormonal changes that mean we can't just sit on the couch and eat cake or juicy vagina muffins. We've got to get out there and do stuff. And there are people depending on us, and I very much believe this, that women are the linchpin of their families. And this big night was a big night for you because you organised the dinner, Mr. in there, you've done that, you've programmed the TV, everything was out on the bench. You even put the glass out for them, didn't you? I know you did that because I did it too. Next slide is looking at perimenopause. This is when the ovaries start to run out of eggs. Very difficult time, and it can happen from about 40. Sometimes it can happen from 35, and symptoms start. Now, none of this slide is very good. There are 15 little balloons here, and we'll go one by one. Flushes and night sweats is typical. It's not just getting hot. Now, when we're talking about the couch and the cake, one of my ladies ruined a couch because she sweated so much. The Salvation Army would not take the couch away. They said, we'll have the cake and the vaginal muffin, but we're not having the couch. They didn't say the other bit of the cake. There are more symptoms. I'm going to keep going. Weight gain and shape change. You gain it around your tummy. That sucks. There are more and more. Skin and hair changes. Oh, my scalp hair, I'm thinning. I'm getting this stuff around the chin. I'm getting extra things in my ears. Sore breasts. So because perimenopause, there can be too much hormone and too little hormone, all in the sort of same few months. And you may not know if you're Arthur or Martha. These type of low estrogen and high estrogen symptoms can all happen, and it's a very difficult change. All right, joint aches and muscle pains. This is getting fun, isn't it? Bloating, just to add to it. Increased tiredness or insomnia, and that waking up at 2 or 3 in the morning and not being able to get back to sleep. That's a real menopausal or perimenopausal thing, and I think that can be disabling, because the one thing Sonias need is sleep. Otherwise, they're nightmares. Mood changes, that can be anxiety, crankiness, low mood, and all of the above. Decreased libido, and that you might not care. You might never ever need to do any of that sexy stuff again, vaginal muffins or not. But there might be someone at home, depending on you doing that, be him a boy or a girl or whatever, and they might get very upset, and that's where relationships can disintegrate, and that can be a disaster. Because if they're otherwise good girl or boy that you have at home and you want to keep them, it'd be nice to keep them, but this can drive people apart. Where headaches and migraines, just to add to the equation, memory and concentration, women just come and say, I'm in a fog, can't think of anything, doctor, I know your name, but I can't even remember it. Reduced capacity to cope with daily activities, irregular periods in perimenopause, vaginal dryness, and sensation of crawling under the skin. It's like ants. Don't get that one. Okay, so these are the other things that women might notice. Trying to have a baby. I'm 41. I'm infertile. It's not happening. This can be perimenopause. Blood pressure will start to change, so we need to get to the doctor and get it checked. Increased risk of diabetes as well. Risk of recurrence of depression that you might have had after pregnancy. Changes in cholesterol. So some women are as skinny as a stick, come to me at 45 or 50, my cholesterol's gone up. Oh, that's perimenopause or menopause. High family history usually. Irritability and mood changes, and life and social changes. So this is a very busy life change and a time of lots of stuff going on. You can get help. There is something out there, even if it's not hormone therapy. Don't put up with it. Get to your trusted women's health GP and get some advice, or at the very least look at our website, because we will have something, and if it's not there and you need help, contact our education people and they will find it by asking someone like me, funnily enough. Now, some women go to their doctor, I think this is happening to me, and please measure my hormones. And they're very disappointed when the doctor said, well, we don't really need to do that. We don't, because hormones will be all over the place in perimenopause. And after menopause, they'll hit the skids. So you don't need a hormonal test. You just need to give me a history. And do you know what? I'm a bit canny now, and Karen's probably the same. I'll look at the first few lines on the referral from the GP and I'll say, oh, I bet you this is perimenopause and we're going to nail this. And it is, usually. I don't always get it right. So hormone levels won't help diagnose or manage menopause. They won't help manage treatment at all, and they won't tell you when periods will end. But premature menopause, as I mentioned before, any cause of menopause before the age of 40 or a cessation or stoppage of periods, that really needs to be investigated. Even if you're sitting there in the seat thinking, God, my period stopped at 35 and I just let it go, please get to your doctor, have a bone density check, and just make sure nothing eventuated from that. So, perimenopause is, I think, a shocking time in life. It is normal, but 20% of women manage it really difficultly, that's severe symptoms. 20% just cruise through. Everyone else is in the middle with some things. You can have ovulation occurring, so contraception is still very important. So remember, if you're still sexually active with whoever's at home in whatever manner, you still need to look at contraception. The latest baby, I think, on record who conceived naturally was aged 57 years. All right, so don't worry about it. If your periods have stopped and it's 1 or 2 years, you're probably all right. All right, so don't worry about it. All right, we'll go back to the slides again because I've got some discomfort and people are fanning more. All right, and the other thing is, if symptoms are bothersome, that's when we treat. Don't sit there with just having night sweat after night sweat, ruining the bed, the couch and whatever. Get some help. You must sleep, you must function, you must be reasonably happy. You mustn't sit there and be a nightmare, all right? And if you think I am the nightmare, get to someone nice like Karen or someone else and stop being a nightmare. You're a long time dead, is what I think. Okay, so having 9 lives is cool, but if I have to go through menopause again, forget it. They're on the couch, hello? All right, so things that we can help, and these are lifestyle things. By the time they're sitting in my room, they've seen a GP, they've probably looked at our website and they're doing these things. But keeping cool, using a fan, a water spray, cool drinks, begging Nellie to put the air conditioning on. Good move, whoever did that. Reducing hot flushes, being active. I'm the big dog walker, so 30 minutes with that cute dog, gotta go, gotta do it. And that's my great, I'm doing this, I feel well, and I'm hoping it's reducing flushes. Stopping smoking. Smokers have an earlier menopause and more symptoms. How about that? Could stop that one. And you save money. I worked out the other day, the lady came, I said, how much do you smoke? We totted it all up. I said, that's your trip to Thailand. In 1 year, you've just smoked your trip to Thailand. She said, oh God. Reducing weight. So the weight acts as an insulator and you'll feel hotter. So whatever you can do, and weight gain is very common around perimenopause and menopause. And other things, avoiding alcohol, avoiding spicy food, avoiding triggers, avoiding stress. Easy to say, very hard to do. We've got to try. But some women really need some treatment. Hormone therapy is very necessary, so HRT was what it used to be called. Some women can't take HRT or shouldn't. And then there are other medications. So if you're sitting there flushing and sweating, not sleeping, and you're a nightmare, there are options out there, and get some help. You can definitely get help. Natural therapies may be appropriate as well. So everything to do with menopause and perimenopause, I think, should be individual based. There is no one size fits all. I see what's the lady's risks, what are her symptoms, what are her problems, and then I try and tailor-make it to that lady for her situation and with her risks in mind. The low-dose pill might be an option still in your 40s. We usually stop it at around 50 because our arteries stiffen then, and the big doses in the pill can be a risk. But you can certainly have that. It's good for contraception, good for some symptom control, up to 50. Hormone therapy, menopausal hormone therapy or HRT is very effective for all of the symptoms of menopause. Some ladies, like I've got ladies in their 70s, I want to be on it, Sonia, I feel good, my skin's great, I feel like a girl, I'm happy, don't take me off it. Okay then, all right, we're good. But again, some women need other medications as well. Not everyone needs medications, but the antidepressant group of medications, for example, some produce sweats, and some actually help sweats. For example, in breast cancer, I'll often be prescribing an antidepressant, not for depression, but actually to reduce flushes and sweats, and that can be very effective. But it can also help mood problems as well. So, we're going to go on to the next one as well. So complementary therapies, there's lots of stuff out there. And when you do Dr. Google or whatever, you'll often come across all the crap at the top, excuse the expression, and then right down the bottom all the good stuff. Go to somewhere like Jean Hale's website or Mayo Clinic or the Better Health Channel, really good sources of information, and see what they say first. But meditation might help some. And Nellie, I reckon we've got to get her, sit her down and do a little bit more maybe. I'm not a meditator. Sonia is just go fast or not go at all. Naturopathy, of course. Sandra is an expert in this area. You see she's very passionate. Find someone who's passionate, knows about it and does the right and safe thing. That's what I really can promote. Herbal remedies can help. Black cohosh, for example, is very useful. Massage, who doesn't want one of those? And phytoestrogens are estrogen-like substances within the diet, for example, in flaxseed and linseed, soy products, typical sort of Japanese, Asian diet, and we think that's what protects those ladies against hot flushes and sweats a bit. But you can do that easily in the diet. So, as Liz Taylor may or may not have said, my grandma told me the good news is after menopause the hair on your legs get really thin and you don't have to shave them anymore, which is great because it means you have more time to work on your new moustache. All right. Wasn't she a darling? Violet eyes. She had violet eyes. So this is the really important serious stuff. So if you thought you're on your seat between 40 and 60, you thought I was having some of that, I might need a bit of help. This is the stuff that so when I see you at perimenopause and menopause, I'm thinking this lady's here in my seat because she has a problem and I'm going to fix the problem. But I'm going to be really sneaky because I'm going to think about the rest of her life, because she's going to live a third to half of her life, I hope, touch wood, in my good hands, after menopause. So I'm going to look at the things that really make an impact on health after that, which is bone health and heart health. So after menopause, there is a higher risk of heart disease. And we think that's linked in with estrogen because estrogen levels on average before menopause are about 400, after menopause are about 20. Any guesses for what a typical male estrogen level is? Any punters out there? Yeah, about 200. Someone say, girl, you're good, I'm going to have you next time. 150. A lot of testosterone, it's converted through to estrogen. So the typical postmenopausal lady not on treatment has much less estrogen than the dude sitting next to her on the bus, all right, or driving the bus, Jesus. All right, so we do worry about heart disease, we worry about blood pressure and changes in cholesterol as well, which can happen around this time. It's sort of genetically programmed, and you can do stuff about it. So heart disease or stroke is a killer of 32% of Australian women. You're all sitting there thinking, God, I'm going to die of breast cancer, but God, you're going to die of heart disease or stroke. And it's really modifiable. We can do something about that. I'm not discounting breast cancer. Of course, that's a terrible thing to get, but we're very good at treating it now. But it affects 4% of women in Australia, whereas this affects 32%. And we can treat this. I can take your blood pressure, do your cholesterol, do your sugar, and already I've reduced your risk if I'm treating it right. So things we can change. Up the top there, Sandra's talked about nutrition. Walking Sputnik, the personal trainer dog, for 30 minutes every day is reducing my risks. Not smoking. I've saved my trip to Thailand and I've saved my money and I've reduced my heart risk. Relaxation, so we have to get Nellie to do more. And weight. We want to be a good weight for our height, and that's a real challenge around menopause. And you have to really want it to achieve that. You have to really want it. It has to click here, and you have to really make an effort. I know, because I'm doing it. Things we can maybe change: stress, anxiety, depression, high blood pressure. I can definitely treat that easy. High cholesterol, walk over, and diabetes, they're easy. Things we can't change, unfortunately, family history, and some have a really strong family history of heart disease or stroke, and some other conditions as well. So it's really important to see your doctor, not just for pap smears and all that sort of stuff, but that's really important. Annual blood pressure check and cholesterol check. It's really easy. I do it. I sit them down while I'm talking to them. I just do the blood pressure. Test for diabetes. I'm doing that in most of my ladies at least once or twice a year. Discuss weight and how we can do that. Everyone can do something about their weight. It just has to click and fit in with their life, because we're all busy and we're all tired, and I think we're all stressed. And know your risks, all right? That's the important thing. And a doctor can go through that, and there are some nice things online for that as well. So estrogen and bones, what happens with bone health? It's a bit cruel, and I'm going to do a funny thing with my hands. Bones grow and they fall away. They're always doing that. That's how we respond to a fracture. That's how we remodel bone, and that's how we grow. But when you get to 30, guess what? the bone growth wins, and after 30, men do this, they lose a bit, but women do this. They lose a lot around menopause. So it's a bit depressing, but again, you can do stuff about it. So after 30, and if you were anorexic or something happened in your youth to then, you've lost a real opportunity to get to peak bone mass, and that can be a real issue for some women, or if they've had a disease like celiac or whatever. Menopause, you can lose 3 to 4% of bone density per year, and osteoporosis is very brittle bone that can fracture with a minimal trauma. And one lady I had lifted a wardrobe. I know that's silly, don't lift wardrobes. But she got a fracture and she was in bed in Canberra where I was working there for 6 weeks. Her only risk factor was menopause and she was a smoker. So I tried to not get her to smoke while she was in hospital for 6 weeks. So this is a little image of rat-eaten bone. You see the bone on the right there? That's your hip bone. And that is osteoporosis, where we've lost bone density. It's not as strong and dense as it was, and it is a risk for fracture with minimal trauma. I've had a lady slip on the bean in a bean in Safeway, shattered her whole hip. It can happen when we're not paying attention. I have fallen. I did it in Chadstone, and it was quite scary. And I thought, God, anyone can do this. I've just done this. I thought I was impervious. Just be aware of your surrounds and environment, and if you do have thin bones, be aware that risky activities like risky skiing or those sort of things, or horse riding for some women, can be a real risk. So talk to your doctor about it. And 1 in 2 women over 60 years will have thin bones. And we can all do something. Every single person in this room can do something about their bones. Now, I've done another numbers thing. 2/3 of these we can manage and we can do something about. The other third are a bit depressing. Caffeine intake, too much coffee can erode bone density. So if you're having 5 or 6 coffees a day, you might be very energetic, but it's not so good for your bones. Tea's not as bad. Too much alcohol, all right? So 2 standard drinks, 100 mils of wine, 5 nights per week is what's recommended for women. Low vitamin D. Get your doctor to do a vitamin D check. Very easy. I do it on everyone. If you come through my door, you're almost guaranteed. Let's do this. We don't get enough vitamin D. Living in Melbourne or Geelong or wherever, you might get a little bit more than us Melbourneites. It's very easy to do a check and a level. We don't want to get skin cancer. We don't want wrinkles. We don't want to have to pay for expensive Botox. So we do the sun smart stuff, but check a vitamin D. It's very important for your bones. Smoking, smokers will have lower bone density. Lack of weight-bearing exercise. It doesn't take much. Me and Sputnik the dog, 30 minutes every day. You might not be able to do that. I get it. You might be up at 6 a.m. organising everyone and get home from work at 7. Do whatever you can. Every bit counts. Early menopause, we can treat that. Family history, we can't. Low calcium. Make sure there's enough calcium in your diet. There's some beautiful things on the Gene Hulls website. It's not all about dairy. Sandra could talk to you all day about this. She hasn't got all day, but have a look at our website. And it's probably been reviewed by Sandra. So, 2 to 3 serves of dairy per day or other calcium-containing foods. Almonds contain calcium, for example. You can do it through diet. Vitamin D, I think most people in Victoria need a supplement over the winter months, unless you're really out there a lot or unless you go to the US or Broome or whatever in our winter. Get your doctor to do a vitamin D check when you're next there. Physical activity, I've talked about. Stop smoking. If I could do anything, the smoking thing is a great thing to stop. Save money, and you're getting healthier. As soon as that last cigarette's gone, I know that's very easy to say, hard to do, but there is help out there. So, is perimenopause and menopause all bad? No, because if you get someone passionate who can help you through it, you'll do really well. And not only will you get through the bad bit of life, that can be rocky for some, but you'll also do better later in life. Never, ever too late to make a positive health change. So around menopause, it's an increased risk of a new creative career or a life change. Some people will be offloading children, although I think they stay at home till they're like 35 now, don't they? Jesus, I've got years to go. Nellie's got even more, and Sandra, don't think about it. Increased risk of a fabulous new relationship. So go and find the new dude or dudette. Don't get herpes from them. Make sure you do everything right. Come and see Karen if you're worried. It's a real risk. They meet them online. Happy, sexy times. Didn't do that for a while. whoops, and then they're gone. So just be aware of it. It does happen. I will go back to the slide now. Thank you, Lockie, that was excellent. Empty nest syndrome. I've had some women crying on me because the kids finally did leave home. Hello. And the other thing about menopause, it's your time for you, as long as you're not a nightmare with the flushes and the sweats and the sleep disturbance and the mood and all that sort of other stuff. I'm going to tell you that the best part about being over 40, not that she is we did all our stupid stuff before the internet. All right, I think it's true. Thank you very much for having me to speak. It's been a delight. Thank you.